there is an increase in using street heroin in many countries. With this onset of social media, there's so much stress going on. There's so much anxiety people have. Unfortunately, not many people are aware what's going on, and they are looking for quick fixes. Not many people understand that, hey, if we have stress, anxiety, maybe we should go start counseling. Maybe we should go see a psychiatrist. So they're looking for quick fixes. And what do they have? They have alcohol, or they have other drugs and medications. And there are some countries where alcohol, for example, like I'm a Muslim by faith, and there are many Muslim countries where alcohol is not freely available. But unfortunately, heroin is, marijuana is, other drugs are. So share with us a little bit on heroin addiction, because where I come from, there has been a massive increase in heroin addiction to a point, Dr. Madrak, it's actually a very sad situation. Because of lack of awareness, many of the drug peddlers are telling them that here is a shot, here is the powder, here is an injection. Take it, give it to your family, and all your stress will be gone. It is so sad that they are not even aware that they are heroin addicts and are creating families of heroin addicts. They're thinking, this is a medicine that I'm using, and it just makes me numb, it makes me euphoric. Share with us a little more about heroin. What does it do when a person uses it? What happens about overdose and all of that concerning stuff?
Yes. And it will be very surprising to people that there are just so many faces of people using heroin. It is not necessarily the experimenting teenager. It can be professionals. They could be young, they can be older people. I've had several older people, even in their 70s, that had been addicted to heroin. And once again, from the people that I tend to see, they really did start off with chronic pain, injury, surgery, and started off with a shorter acting opiate, and only eventually moved on to even IV, intravenous heroin, because of that building of tolerance and the lack of being able to afford it, or maybe they got cut off from their medical providers because they were overusing it, or going to multiple doctors, or doing things that seemed dangerous, and decided that they were not going to offer that for them anymore because of the problem that they were having. And then people end up going to the streets and finding things that are much more potentially dangerous. And, even though it is quote unquote heroin in this country, what we really are seeing, what people are really dying from, is actually the fentanyl, because there is almost very little pure heroin that is on the streets in the United States at this point in time. That all of it is what we refer to as cut, meaning that pure heroin is diluted so that it is multiply distributed over as many people as possible, as many doses as possible. And they're using that fentanyl that is actually 50 times more. There's a potent than heroin. There is actually, just to give you, which is just frightening to think about, sometimes there's actually even what they refer to as the derivative carfentanil. Carfentanil is a derivative of fentanyl, which is actually 100 times more potent than heroin, and it is actually used as elephant tranquilizer, just to give you the level of danger. And that, I really believe that fentanyl, which is much more readily available than the carfentanil, which in some respects is a good thing, but the fentanyl is the reason that we have so many overdoses in this country. And it's literally doubled in the United States. The fatal overdoses that we've had have really doubled in the last 3 years. I feel like in 2019, it was around, or or 2020, around 50,000 or so. And then moving into some of the statistics, it was getting closer in 2020 to maybe even closer to 70 and 80,000, because it's really hard for them to get a true number of the actual cases of fatal overdoses. And because so much is hidden, I feel like there's probably even more than that. That is probably even the minimum. What they're looking at as getting closer to between 20 and 21, that there's even over 100,000 cases of fatal overdoses in the United States. And with the COVID-19 pandemic, talking about people even using more substance, whether it's boredom, unavailability of stimulation, grief from loss of family members, being sick of themselves, that I can only imagine what the numbers for 2022 are going to be if we have already doubled in the last 2 to 3 years, what that will become. But in the United States, they're trying so hard to get the point across to people that they will not hold any legal responsibility or press any charges for people if they see or witness to somebody that is having a potentially fatal overdose. If that person is under the influence of the substance themselves, that they will not incur any legal charges for that. And even though we try to make that known to people, I think out of fear, they're just so afraid of potential consequences or in denial themselves, and then really don't seek out that emergency treatment. And then unfortunately, people die. And I think more word has to get out for that, as well as rescue medication. I know that there are many other countries that are trying to work with naloxone being an emergency rescue medication. 20 plus years ago when I was in medical school, and we actually said that naloxone, which is that rescue medicine, which actually reverses some of those opiate overdose symptoms, was only in the hands of emergency providers. So it was really the rescue teams that were coming, paramedics that were able to have it, emergency physicians. And now it's being available even through free kits to family members, so that they can actually help, and friends and loved ones that can provide this medication for people, whether it's by a nasal spray or an injection, before even the emergency team gets there to help reverse those symptoms. Because getting back to the fentanyl, because it is so potent, many times people not only need that one dose of the naloxone, but repeated doses, at least 2 to 3 doses, to really reverse those symptoms of that very potent substance.
Oh, wow. Such an interesting data, because, we all know that what a grave problem opiate addiction is in our country, and how many lives are being lost. Now, Dr. Madrak, we've had we have the naloxone, which is obviously an emergency medicine that we revive folks from the effects of the heroin and fentanyl. Share with us a little more for those who or non-medical people about, first, how does heroin and fentanyl kill? Meaning, why is it so lethal? And secondly, what does this naloxone do to revive them?
Mm-hmm. Well, it actually pulls the medication off those receptors and will put somebody in an immediate withdrawal, which could be daunting to that person that's with them, because the patient or the person may feel very upset, they may feel agitated, they may even get aggressive, because they're going from that overdose state to the complete withdrawal from those receptors. But really, if somebody actually has that much of an opiate in their system, they usually have fatalities due to either cardiovascular issues or most likely something like respiratory depression, which is why, certainly doctors will look at someone's history. And if somebody has some very serious cardiac issues or severe respiratory issues, they may not even consider an opiate pain medication to be an option for them at that point. But certainly with such large amounts of a substance, even people without that predisposition to having cardiovascular respiratory issues, it will cause that depression. And then, of course, unfortunately, if you're adding that medication to other substances that could be respiratory depressing, such as your tranquilizers, muscle relaxants, even other types of medications that could be possibly sedating for that person, that can be also very dangerous. So it's really looking at the safety level of all of the substances combined that the physician has to look at, or that healthcare provider.
Wow. So, it does look like a pill, but we don't realize that the effects of this pill are so serious. So just to sum it up for our listeners, so what you said is that stuff like heroin, highly potent opiates and fentanyl, they can cause, the reason that they're so deadly is because they can suppress your breathing or respiratory system or have effects on the heart, which is going to put that person in that acute crisis of including death. Even combining these medications with other sedatives, so you have two medicine which are sedating this person or stopping his breathing, so clearly we can imagine how lethal that is. It seems like, it boils down, I think, to individual responsibility as well, Dr. Madrak, right?
Yes, and family members and loved ones really treating this person with compassion, because if there's any point that I would like to make is that no one wants to become addicted. Nobody is happy being addicted, and it really is truly a physical diagnosis. It's a medical diagnosis. It's a mental health diagnosis, just like any other. And to treat someone with non-judgment and compassion, and to educate ourselves as much as we can about what these signs and symptoms are, so that we can be of help to that person before it's too late. And it's important also to know what are those signs of overdose. So the medication will actually create very pinpoint pupils. So if somebody has very small pupils and they seem very limp and lethargic, or maybe having trouble breathing or having very shallow breathing, they might be choking or seem very pale, or have discoloration of the skin, or feel cold and clammy, or possibly if you're checking their pulse, they may have a very erratic type of pulse. That this might be an indication that the person is in the midst of an overdose, and that emergency intervention really does need to be provided.
I hear you. Such great points you raised. One is that if we do have a family member who unfortunately has become addicted, to take a non-judgmental approach. That's first and foremost, and to, show compassion to them and realize that, they're going through this problem, and that how important it is to get them that help. And secondly, you mentioned, and this was so important, I was going to ask you that question, is that how do we know that a person is severely intoxicated with heroin? And you mentioned these symptoms to look out for, these pinpoint pupils. Say, for example, we do, like, all of a sudden, we notice our family member, he is unconscious, and we open his eyes and we see all of this. We see his cold, clammy skin. And are there any other signs or symptoms that we can see either in his body or, surrounding, which can tell us that, hey, this is not a heart attack, this is a heroin overdose? Is there any other indications for that?
There might be some indications that in the surroundings, there may be some paraphernalia. There may be things that look like needles, or possibly some powders or some pills or different substances around, maybe even some prescription bottles. So it may be helpful to see if there's different things. There's tourniquets that sometimes people will use to in order to inject into a vein if they are using intravenously. You can also see on the person's skin, do they have any of what we call track marks or needle marks that might indicate that a person is using a substance either on their arms or legs or different parts of the body, neck. So it's just really important to be informed and just watch out for those early indications so that it's not too late. And it's so easy for us to want to be in denial that these types of things are really happening to a loved one and to brush it off as, the doctor is giving them this medication, so it must be okay. And not really realizing that people can be very clever and deceitful and cunning, that sometimes even their medical providers may not know all of the things that are happening behind the scenes in order for them to obtain that medicine, because they're trying very hard for their family members and friends and their doctors to not see these signs, because it's terrifying for them to not be able to have that substance available to them.
Absolutely. So there not only is denial on the on the patient side, but there's denial on the family side as well. Because sometimes we get so scared that we don't even want to know that our loved one has become addicted. Yeah, but as you said, that awareness can be that first step, educating ourselves and understanding and taking charge of our own care, being cautious and cognizant of what medicines we're taking, what's being given to us. I think that's so important, So now I think you helped us understand quite a bit about opiates, addiction, dependence, what to look for, signs of overdose, and of course, what remedies, which is in the form of naloxone. And you just explained it so well that, not only the emergency providers have it, or emergency services like police, EMTs have it, but also family members have it. Maybe in our medicine cabinet have, a couple of syringes of naloxone, so that if we have such an emergency in our family, we can save a life. I think that is just so important. Now, for the families, and I want to come to you about the treatment of addiction, means what you are doing. But before that, I was just curious to ask you this question, like, where can families get access to this naloxone? Like, is it something that's available in the pharmacy? Like, how can they have that?
Yes. So the naloxone can be provided by a prescription by their healthcare provider. So they can actually prescribe it and the insurance companies are covering it. There are also many police stations and even emergency departments and even some community programs that are offering free naloxone kits to people. So I think the stigma needs to be decreased and there should be more awareness and more conversation. And it's not about hiding this. You don't want to hide things because it could potentially save someone's life. So if somebody really needs it, there are these different community programs and even hospital programs that are making this available. But basically, the doctor, at this point, many of the pain prescribing doctors are actually also ordering naloxone by prescription at the same time. So if, say, for instance, oxycodone or OxyContin or tramadol, or whatever it might be, is provided for any length of time, whether it's for a couple months treatment, many times I will see a prescription being ordered for naloxone for that patient so that they can have that readily available in their cabinet. And it's important for the family members not to be afraid of that because a lot of times the patients are even afraid that they have this in their home. But if it's something that they need, it's more of a safety issue. It's better to have it available than not to have it available. And it's important to know how to use it and to read those instructions in advance. I think it's also important for family members to just have their own education. There's different support groups for family members too. that they can have their own counselors to talk about their feelings about that loved one having addictions. I think that there's what they call NAR-Anon, which is a Narcotics Anonymous meeting for people and family members to be aware, not just for Narcotics Anonymous, but for family members and loved ones that have people of addiction. But it's important for family members and friends not to get caught in a trap of enabling that person either. That person is not the same person in the face of addiction. They may be a little bit more deceitful. They may be a little more manipulative than usual. It's not their typical personality, anything that they will do to obtain that substance. So they may be looking for money. They may be looking through your medicine cabinet to see if there's something that has been unused in your medicine cabinet. I've even heard of these unusual situations, which I'm even shocked about. Being in the field, I'm always surprised to hear one more thing, but even for people that are selling their homes, that people will often go into houses, open houses, and look at homes and search through the medicine cabinets for narcotic pain medication. And they're not really there for any other reason. So it's very easy for family members that are in a little bit of denial, especially, to be facilitating continuing the addiction by giving money, by sharing medication, by helping the person to obtain more of this medication if that's something that's not good for them.
Oh, wow. You really raised such important points, like firstly, saying that, like, I was just thinking to myself as you were answering this question is about, how we were taught CPR in our schools and in our trainings. And I think, having this naloxone in our home is pretty much, I guess, just like that, hey, we have a patient or we have someone who's taking these medicines or is at risk, then we should have a backup to protect them. I think that's such a great way of looking at it, rather than looking at it through an angle of shame and embarrassment or denial. Addiction and dependence can happen with anyone, no matter what their education level is, or what the genders, or so it's something I think it's important that we accept it and take those right steps. And then you shared something about enabling and the family, how they can support. That was fantastic. What you shared is family members firstly understanding these signs of dependence and addiction, and then not giving money or setting up other healthy boundaries. And Dr. Madrak, some of these names of the support groups and organizations that you mentioned, we would appreciate you sharing that with me, and we'll put it under the links of those under the video for folks to reach out there. Yeah.